My name is M. Sky Reeve. This is a continuation resubmission of my naturopathic framework video assessment. My student number is 00118622T. Okay, so for a naturopathic consultation, your first appointment would be approximately 1 to 1.5 hours long. Now you should bring along any recent results, so blood test results, specialist assessments, or anything relevant to your condition. The consultation would usually start with a detailed collection and assessment of your overall health and medical history. Now initially I may utilise one or many of the following techniques whilst recording a thorough case history, including childhood illnesses and family history. So we would start with an examination of your presenting symptoms. We would go through an assessment of your past and current medications. We would go through a dietary analysis and any recommendations. We would study any existing pathology results and any recommendations for further testing from other practitioners. We would do a tongue and nail analysis, blood pressure test, zinc tests, urinalysis. We would also explore differential diagnosis, so distinguishing a particular disease or condition from others that present exactly the same symptoms. Then we would go on to assessment and analysis, which in turn would be used to form a plan or a treatment protocol, which would be discussed with the patient, and if the patient is 100% compliant, then we would go on to discuss further supplements, further treatments, etc. So with all this, a SOAP chart would be used and formed, so subjective, objective assessment and plan, filled with information from the patient and including information from other practitioners. Now everything in this consultation would be documented about the patient, their care, the treatment, test results, symptoms shown, the initial cause for the consult. A high standard of patient documentation is important to meet legislative and professional requirements. Not only this, but to facilitate communication between staff. Documentation in accordance with the state, territory and federal patient record law remains on file either in lockable storage or secure encrypted access areas when not in use. Practitioners should take all reasonable steps to ensure that personal information is securely stored and protected from misuse and loss, and from unauthorized access, modification or disclosure. These documents must not leave the clinic. Naturopathy is a health service, therefore there are legalities that must be adhered to. The Code of Conduct provided by the Australian Traditional Medicine Society acts as a guide for ethical and proper practice. This code was established as the basis for ethics and professional conduct, and under this we are expected to put into practice these principles, covering the points listed, with importance placed on conducting ourselves ethically and professionally at all times. And most importantly, practitioners do not cause harm to patients. Now, privacy policies must be clearly expressed and up to date. Due to the nature of the work performed and the services provided by the Australian Traditional Medicine Society, practitioners will collect, assess, use and handle personal information from a client. Now, this is where the healthcare practitioners from all modalities, allopathic and natural, are bound by the Privacy Act 1988. Now I hope I have given you a better understanding of naturopathy and the consultation process. Thank you very much.